Antibody tests are one of the most common types of HIV tests. They look for antibodies produced by your immune system in response to an HIV infection. If you have HIV, your body will produce HIV antibodies. These tests detect the presence of these specific antibodies in your blood or oral fluid. Many are rapid tests, providing results within 20 to 30 minutes. These rapid tests often use a sample of oral fluid or a drop of blood from a finger prick. There are also laboratory-based antibody tests which require a blood sample drawn from a vein. The primary benefit of antibody tests is their widespread availability and relatively low cost. They have been the backbone of HIV screening programs for many years. However, it's important to understand the window period. It takes time for your body to produce enough antibodies to be detected by these tests. This period can range from 3 to 12 weeks after exposure. The concept of the window period is crucial when discussing antibody tests for HIV. This is the time lag between potential HIV exposure and when your body produces enough antibodies for a test to detect them. During this window, a person can be infected with HIV and potentially transmit the virus to others, yet an antibody test might still show a negative result. For most standard antibody tests, this window period typically ranges from 23 to 90 days after exposure. Healthcare providers often advise retesting after a certain period if a recent exposure is a concern. Understanding this window period is vital for both individuals seeking testing and for healthcare professionals providing counseling. A more comprehensive look: antigen-antibody combination tests. These tests look for both HIV antibodies and an antigen called P24. The P24 antigen appears in the bloodstream shortly after infection, even before antibodies are produced. This gives combination tests a distinct advantage. The window period for antigen/antibody tests is generally shorter. These tests are usually performed on blood samples drawn from a vein and processed in a laboratory. Their enhanced sensitivity in detecting early infection has led to them being recommended as the preferred type of HIV screening test in many clinical guidelines. For most lab-based antigen/antibody tests, HIV can be detected as early as 18 to 45 days after exposure. This earlier detection is incredibly valuable.